Hi, my name is Dr. Kofi Kawasanti, and I'm a specialist obstetrician and gynecologist. Today, I'm here to take you through the discussion that I have with my patients when they come for their pap smear results. So usually I do this by way of illustration so that the patient can have something that they take home with them to refer to should they have any questions. So when we do a pap smear, we're looking for a virus called HPV. So HPV stands for human papillomavirus, and human papillomavirus is the same virus that's known to cause cervical cancer, which is cancer of the mouth of the womb. So when we do a pap smear, we're checking to see which type of HPV you have and also how close it is to actually causing you cervical cancer. Because anything before cervical cancer, we're able to treat. Anything after cancer we can treat, but obviously it does get a bit more complicated. So when we do a pap smear, we check it. Do you have HPV? Which type of HPV do you have? And then also, how close is that HPV to actually causing cancer? So the high-risk HPVs are known as type 16 and 18. So these are the types that, if acquired, can cause cervical cancer at a much rapid rate. So acquisition of the type 16 or 18 can usually lead to cervical cancer within about 5 to 10 years thereafter. If you're someone who's got a chronic condition, HIV, diabetes, or anything that would suppress your immune system, then that 5 to 10 years now becomes about 3 to 5 years because now your immune system is suppressed. Therefore, the HPV is able to progress much rapidly. So we're checking, do you have HPV? Which type of HPV do you have, and then also how close is that HPV to causing cancer. So that goes through a number of stages before it gets to cancer. So it can actually be normal, where there have been no changes as yet. It can be atypical, it can be low grade, it can be low grade, almost high grade, or it can be high grade before eventually getting to cancer. So all of these stages before cancer we can actually treat, and we treat it by doing what we call a colposcopy and a cone biopsy, which is a procedure that we do in theater. So if you think about the anatomy, if this is the uterus, so this is where a pregnancy would be, then the mouth of the uterus is where a pap smear is obtained from. That's where we get a pap smear sample from. So when we get the sample from here, it tells us that the HPV is at the cervical os. So then when we go into theater, we usually put a little dye to stain the cervix so that it can actually light up the HPV, and then we do what we call a biopsy of the cervix. So then we take the piece of the cervix away with nice margins around where the HPV lesion is, and we send that to the lab for diagnosis and also to confirm the extent of which the HPV had actually affected the cervix. So in essence, this procedure is both diagnostic and it's also curative. So by taking the piece away, we are in effect treating you. And once the treatment is done, you are effectively clear of HPV, because remember, HPV is the type of virus that literally only lives at this point in the cervix and nowhere else in the body. So it is not a blood-borne virus.